Opioid deaths are finally starting to fall across the country. Here in Alberta, over the past 2 years, deaths have declined dramatically. But as Kevin Green reports, the province is continuing to move to overhaul addiction treatment and close safe consumption sites.
Outside the SafeWorks consumption site on 13th Avenue Southwest, 31-year-old Rebecca is waiting for the doors to open. She and her husband, Jay, are both users. They've been homeless for 6 months. She says SafeWorks is their lifeline.
So you think SafeWorks and places like it save lives?
Absolutely, 100%. No doubt about it.
Have they saved your life?
Yes.
Opioid deaths hit a peak in 2023 when in the first 6 months of the year, 952 people died in the province. Last year in that same period, it fell to 602, a drop of 37%. In a statement to CTV, the province's Minister of Mental Health and Addictions says, "It is good to see opioid-related death numbers decline. However, we know these numbers fluctuate from month to month." But went on to say consumption sites must close, stating drug consumption sites were designed as short-term measures. They were not meant to be permanent. The government plans to move to a new method of treatment, including a virtual opioid dependency program. The NDP addictions critic says closing the SafeWorks site will not promote better outcomes for addictions or solve social disorder.
When folks are able to access the supervised consumption site, it means that they're not using at the public library, they're not using in the city at City Hall, they're not using in stairwells and doorways of businesses.
The province has been talking about closing SafeWorks since 2021, but wanted city buy-in. Tuesday, Councillor Landon Johnston will present a notice of motion asking his fellow councillors to do just that.
The whole premise of it is to ensure that the city of Calgary is on the same page with the province of Alberta, right? We had an experiment with the Sheldon Schumer Centre and it clearly didn't work.
Back at SafeWorks, Rebecca says she's already seen the results of government cuts and says it isn't pretty.
I've already noticed an impact on the community due to a cutback on funding. People are sharing equipment, becoming more violent when equipment isn't available.
And Kevin joins us from the Sheldon Schumer tonight. Kevin, if it isn't the availability of safe consumption, then what's driving the decrease in the opioid deaths?
There's a number of factors, including the way users ingest drugs more, are smoking them now rather than injecting them, leading to a lower rate of death. Also, there's been a change in the toxicity of some of the opioids hitting the Canadian black market over the past couple of years. Another big factor is the wide availability of naloxone kits like this one, which can be used to help somebody who is in the throes of an overdose. All of those also factor in with education, which is where safe consumption sites like SafeWorks come in. It's been a big component of what they've been doing since they were founded. Tara?
Okay, Kevin, thank you.